Good afternoon, Chair and Madam Vice President. Thank you for having us here this evening. My name is Corren Johnson. I'm Director of the Department of Transportation, and so we do have a presentation to go through in our response to this hearing request. So before we get started, we'd like to take a look back from a historical standpoint. Throughout the nation, there have been changes. Until roughly a decade ago, Baltimore, like most cities, had very limited bike infrastructure. And with a growing focus on safety for the most vulnerable roadway users, greater awareness about greenhouse gas emissions, and the need for sustainable transportation, there's been greater interest to build safe and comfortable facilities. And it's focused on the safety and comfort of people of all ages and abilities. And so there's different types of facilities that we will install. You'll have the separated bike lanes, which physically separates cyclists from moving vehicles. You have temporary or semi-permanent devices that are installed, including the rubberized curbs, flex posts, and sometimes even large planters. And then there are those permanent changes where it includes concrete curbs, barriers, and on-street parking buffers. And so in this slide, from left to right, we have images of Maryland Avenue as well, and then a 2016 pop-up DOT protected bike lane at Central Avenue. The Baltimore City Bike Master Plan was initially adopted in 2006. It then transitioned, and in 2015, there was an updated master plan. The goal for this one was to create a network of bike facilities, but it wasn't very specific about where or how these low-stress facilities would or should be built. And so then this led us to a 2017 addendum, and that's what focused on establishing a plan to build citywide network of separated bike lanes. So we'll get into a little bit about the bike master plan. The potential roads identified for bike lanes includes looking to seeking connections for residential areas to destinations such as schools, jobs, shopping, entertainment, and parks. Locations that possess high traffic volumes and speeds, and other roadway characteristics that make riding less safe. As far as the factors of prioritizing implementation of the network, these include building to other existing low-stress facilities, maximizing connections to, again, jobs, transit, providing opportunities in low car ownership neighborhoods and also low-income neighborhoods. And the plan itself recommended to have 77 miles of separated and supporting bike facilities that would be implemented between 2018 and 2022. Now, in contrast, in contrast with some of our peer cities, in Boston, for example, they have 76 miles, DC 44, Seattle 63, and Portland 35 miles. And so moving forward, many cities are developing ambitious plans and funding to dramatically expand their networks. Here we have an overview of the bike facilities kind of built out in the mileage per year. You can see the different categories listed there: the separated bike facility, the bike boulevards, bike lanes, shared bus bike lanes, and so on. And so overall, from an annual standpoint, we ramped up from the 0.61 and then going up to over 16 lane miles, then to 10, then to 6.3, and then in the last year, 3.57. So all total, we have just under 37 miles. We are making progress, but it's not as great as we had planned in the original plan. The next slide is just a visual graphic of where we have our existing bike network, and anyone can search on Baltimore City DOT's website and find this information. I know it's a little bit hard to see on the slide, but we have it color-coded to designate those different types of facilities, so like the separated bike lane versus the shared bus bike lane, for example. You'll see here, excuse me, a breakout of a visual representation of what our CIP program looks like, so our annual funding through the city's process. So in the fiscal 23, there was 3% of our budget devoted to bike facilities. In 24, 3%, and in the fiscal 25 plan that's been submitted awaiting approval, there's 4%. In comparison, the blue areas represents the alleys and footways. The orange represents our bridge program. The gray or silver color represents resurfacing. The yellow are the reconstruction, streetscape type planning, and also planning projects. Green is traffic, and then the blue are more footways and sidewalk related type of projects. So again, I talked about the CIP, and that is very much a limiter in what we're able to do for all of our program, but particularly in our bike program and developing new infrastructure. We are always seeking funding for the planning, design, and construction of separated bike lanes and the other facilities, but of course the separated bike lanes, because of the cost, they're very dependent upon us applying for and winning various state and federal grants. With those, typically we have to provide a local match. Generally speaking, it might be 20% of the total cost. Sometimes it might go up a little bit more to be more competitive. And so recently we've had greater success with the infrastructure bill and other grant efforts of securing grant funding and moving projects forward. There are many different benefits of bike facilities, and in this kind of circle here, you'll see the safety, health, financial benefits, economic development, equity, and quality of life. The thing about separated bike lanes is that it makes biking safer for those that already bike, but it also encourages those who wouldn't otherwise bike because it's not safe enough without a low-stress facility. So this allows and encourages families, people of all ages with their younger children, to get out and ride as well. The presence of cycling, more cycling, further increases safety as drivers become accustomed to seeing cyclists and driving more cautiously. And the separated lanes also do double duty as traffic calming, which reduces the amount and severity of vehicle crashes. And these crashes, of course, occur with other vehicles, with pedestrians, and with cyclists. Facilities are also used by people in wheelchairs and those using other transportation options like scooters. And so having safe and available infrastructure is necessary to increasing micromobility usage and providing opportunities for lower cost and more sustainable transportation options. From a health standpoint, it improves air quality, provides people with exercise, helps reduce heart disease, reduce stroke risks, improves mental health, and improves access to health care. These dedicated safe spaces for biking and walking help kids also be active and gain independence. States with the lowest levels of biking and walking have on average the highest rates of obesity, diabetes, and high blood pressure, and this is according to the American Heart Association. Women who walk or bike 30 minutes a day have a lower risk of breast cancer. A 30-minute round-trip bicycle commute is associated with a better mental health in men. From a financial standpoint, it reduced household costs by lowering car dependence. It can also provide greater access to jobs and opportunity. From an economic development standpoint, it can attract and retain educated workforce and companies that hire them. It attracts new development along major bike routes when a connected network is present to get around. From an equity standpoint, it improves mobility and can reduce disproportionate transportation burden costs on low-income residents and households. From a quality of life standpoint, it provides recreational and transportation amenities, creates travel mode choice for all demographic groups, and from a traffic standpoint, it can help reduce congestion as the popularity of biking increases, which can reduce vehicle trips and increase the transit mode share. This in turn also reduces conflicts between vehicles and bikes, again, tying to the safety. Earlier, it was referenced about transit and the last mile problem, and so this is a visual graphic of what we're talking about. People are getting from their residences to transit, or from businesses or their jobs, places of employment, wherever their destination is, to the transit location. This is a very pressing challenge that the transportation industry faces today. According to a recent Census Bureau finding, just over 46% of all public transportation commuters prefer to take buses instead of other forms of travel. However, transit stops only provide transportation to preset high traffic locations, leaving many commuters to walk the first leg or the last leg of their trip. This has that relationship to the larger public transit needs because this last mile concept helps to integrate with and improve access to transit. There are On the buses, they're able to install their bike. We're able to tie this into transit hubs that have bike racks and then integrate it with our separated bike lane network with TOD sites. So whether utilizing bikes or e-scooters that are available throughout the city, these facilities connect people to opportunities. Closing this gap makes transit more attractive and feasible. And of course, we work closely with MTA on our dedicated bus and bike lanes and transit facility initiatives that integrate bike infrastructure. For example, the East-West Transit Priority and the Mondawmin Raise projects. From a community engagement standpoint, a typical major bike project has meetings that will be referenced the 30, 60, and 95% design stage. In certain cases, even if we have like a concept level, there might be engagement prior to that 30% time frame. For a quick build type installation, especially one with coordination with a resurfacing project, then the design needs are a little less in depth, but there's still engagement, and usually there's going to be a 2-meeting schedule, kind of in that 50% range, and then more in that final design stage before the work begins. And so from a DOT standpoint, we identify priority projects to implement from the bike master plan. We come up with some initial concepts to have something to come and show and discuss with communities at their community meetings. We gain that feedback. We'll then look to develop a preferred alternative, and that's taken to that 15% concept design. We have those meetings potentially at that 30, 60, 90 stage. And then at that 95% design stage is when we develop the construction schedule, and then we get to 100% design. We will then go through and do more notification of construction construction start a few weeks before construction begins, and of course construction will begin. There are times also that during construction, community meetings will have a request, and we will go and attend to give them updates on the projects during those times as well. Getting into a few other areas of community engagement. Once a month, we compile data from 311 reports of people parked in bike lanes and dispatch parking enforcement to target those areas with the most reports. These turn into social media posts where we announce about the enforcement. We post on our social media, and these these typically generate roughly 25 comments each. And we usually post 4 to 6 locations for a total of 100 to 150 positive comments across all social media. We have been announcing whether these bike facilities are open or closed during work on major roadways, major bike arteries during our road closure press releases, which has been also giving us some resounding thanks. During the installation of the 28th Street changes, we posted regular updates on this progress. This allowed us to enter the conversation with people who were for and against the changes. When we explained that these changes helped to slow traffic down and keep things safer for businesses, homes, and pedestrians, we were met with a lot of positive feedback. During 2023, we received 4,106 positive comments online for work we had done around the city. An estimated 1/4 of that came from posts about bike lanes. Behind the West Baltimore United project, the 28th Street Bike Lane survey that received the most feedback out of any of our Streets of Baltimore surveys ever. Additionally, we have secured a nearly $10 million Safe Streets for All federal grant, which incorporates widespread educational campaigns. So there is more to come that we're going to be working through that grant process to develop more robust community engagement and meet people where they are. This is one of the projects that we're having here as an example, the Maryland Avenue Cycle Track Safety Program. The protected bike facility provides a safety benefit to non-bicyclists as well. Installation has resulted in fewer fatal and injury crashes for motorists, bicyclists, and pedestrians. The crash reductions along Maryland Avenue counter the observed increases in crashes that we've seen nationwide. Separated bike lanes and bicycle boulevard infrastructure serves as traffic calming, which again makes the street safer for all. And what we're able to do is we can observe and evaluate, make adjustments, and then look at the pre and post crash data to see the effectiveness of those projects. These are just a visual graphics showing the reduction in crashes before installation that went just past 2016, and then that downward trend until recent times. This slide also, you can see that there is a downward trend. So the blue is the pedestrian. So there is that downward trend where in 2015, there were 11 pedestrian crashes, whereas in 2021, there were only 3. In the green, now in 17 and 18, there was a slight uptick, and that is because we actually had more people coming out and biking. So if we were to compare the bicyclists and crashes beforehand and after the project, overall the crashes are going down, but there was an initial uptick just because more people were using it. And so that's why you'll see in 17 and 18 that it went up some. And then the last graph shows the injury and property damage both before and after the installation, which also the property damage has that downward trend. The injuries in this graph are a little bit constant, but there's been a slight reduction, with 22 being 29 injuries as opposed to the rest being mostly in the 30s. And so I would just like to circle back on the safety aspects. And so although this is a bike hearing, and I know there's a lot of impressions and questions people have about bike infrastructure, but it really is a safety issue, not a bike issue. And so those who are not traveling in a protective bubble, the pedestrians, bicyclists, scooter users, and wheelchair users, those are our most vulnerable roadway users. If these most vulnerable roadway users get hit, there aren't crash safety devices around them, and an airbag won't deploy. I personally have been in a crash as a passenger and experienced airbags being deployed and the car being completely mangled. Aside from soreness, bruises, and discomfort, I had no injuries that required any type of true medical attention. But if I had been hit outside of that vehicle, I would likely not be here today. In 2023, DOT received 1,862 requests for traffic calming. These are citizens concerned about safety. They're concerned about speeding, crashes, and the resulting damage, injuries, and potential loss of life. Many people request speed humps in their neighborhoods because they are concerned about the safety of their kids and neighborhoods. And also in fiscal 23, we striped 333 crosswalks because communities were concerned about the safety of pedestrians, in many cases children, crossing the street. We should all be concerned with the safety of our fellow Baltimoreans, working together to value and protect lives. We should be concerned about the safety of people like Wayne Richardson and Edgar Draper, who were involved in a crash and died while riding a bike. The same we are concerned about our personal safety and that of our close family and friends. So with that, I'd like to just say thank you for the time, and my team and I are here and available for any questions.